Welcome back. Well, you always know it is important to brush and floss your teeth, but are you getting regular exams? Joining us is Dr. Richard Aguila with the Jacksonville Dental Specialists. He handles all types of dental cases, but today we're focusing on oral cancer as it is Oral Cancer Awareness Month.
Yes, it is.
And it's something to know the warning signs and symptoms of should you unfortunately ever find yourself in this position. It's good to see you. Let's talk a little bit about if it is found early. You say this is something that you have a high survival rate of.
Absolutely. Diagnosis with any cancer is key, and oftentimes the dentist, your general dentist, your dental specialist is involved in the early diagnosis, because we oftentimes see patients at least twice a year for their cleanings, once a year for an exam, and we identify oral cancer. And we do, each of your, everybody's dentist should do a full mouth, oral cancer screening once a year, and when we identify it, success rates in treatment are as high as 80 to 90% when it's identified early.
So what is the dentist looking for in the exam that would lead them to believe that you potentially might have oral cancer?
Yes, we do a full oral exam, and things that we look for are white and red patches, on the gums or the lips or, the tongue. We look for ulcers, sores that don't heal. We look for lumps or bumps that are hard in the mouth. We ask patients if they have, jaw pain, expansion of the jaw. These are just a few of the things that should be part of an oral cancer screening exam. And
again,
if caught early, can really help with the patient's prognosis.
What are some of the risk factors for getting cancer?
Risk factors. There are two main risk factors. The main ones are smoking and alcohol. Smoking or alcohol increases your chance anywhere, depending on the study, 5 to 10 times. If you combine the two, heavy smoking with regular alcohol consumption, then it increases it even 15 times more. So that's something that you have to keep in mind. Heavy smoking is more than half a pack a day, 10 cigarettes a day, and drinking is 2 drinks on a daily basis. Other factors are overexposure to the sun, which oftentimes leads to lip cancer.
Okay, all right.
There have been a lot of studies that show today that the human papillomavirus, HPV, you often hear it in commercials, being involved in cervical cancer for women. Now it's been identified as a possible risk factor for oral cancer as well. They have different strains of it. So that's another risk factor that's involved.
So how is it then diagnosed? I'm assuming once that you determine that there's some problem areas within the mouth, biopsies, is that typically how you would go further to actually diagnose it?
Correct. My role as a dentist is to educate my patients, let them know the risk factors, identify any lesions, and a definitive diagnosis is only confirmed with, as you said, a biopsy. It could be either an excisional biopsy where we've removed the entire lesion, or incisional. And from there, we send that specimen over to the oral pathologist, and they do a microscopic evaluation of that specimen. And that's when we have a definitive diagnosis. Once it's diagnosed, then we typically refer them to an oral surgeon or ENT surgeon to treat and manage it.
What about prevention? So the smoking and the drinking, that's something that we can do to limit our intake of. Quitting smoking tomorrow. If you're drinking, drink in moderation.
Absolutely.
What else?
Yes. Smoking and drinking are the key ones. Okay. Limiting your exposure to the sun as much as you can.
Sunblock. You didn't even think about putting sunblock on your lips.
Lip balm, things of that nature. It's been shown, the human papillomavirus. There's studies that are supporting preventing the human papillomavirus as well. It's still early in the game. So these are all things that you can do.
It's interesting though that the two that you say that we should really be are totally in our control. A lot of times you look at like genetics, you look at things that you have no control over, have a history of it. This is something with smoking and drinking. Yet again, every time we get physicians on here, they always say the first thing you should do, stop smoking if you're smoking.
Those social behaviors are key. And there are that 25% that don't have the risk factors. So as you said, patients may not have any of these risk factors, but may have a genetic predisposition to having, oral cancer.
Why it is, again, so important to go see your dentist to make sure that you're getting a good screening to notice any abnormalities that you might not notice. Very quickly, you guys do the monthly seminar.
Yes.
You have another one coming up, and people can come out and talk really about anything, you say.
Yes, we have a monthly seminar. We pushed ours back a little bit this month due to a schedule conflict. It's going to be on the 26th of April at 6:30. We talk about dental implants. We talk about all the other services that we provide. We answer pretty much any question that patients ask, and then from that seminar they're able to get a free consultation to see one of us.
Very good. Good to see you again,
Good
Dr. Aguilar. Appreciate you as always, and thanks to Jacksonville Dental Specialists, of course, for coming on and making the segment happen. You can call them at 904-460-4201 to schedule a consultation. You can always go to their website to learn more, JacksonvilleDentalSpecialists.com.